Good morning, everyone, and welcome to the WellMed Charitable Foundation Caregiver Teleconnection. We are at the end of a series on emotions. And of course, Dr. Sklar and Lucy have saved the hardest for last, maybe, and that is a topic of sadness. So let me tell you a little bit about our speakers, and if you've never been on before, you would have not heard this. Dr. Elliot Montgomery Sklar is a public health professional focused upon supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, the United States, and online. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. Now, Lucy Barylak received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. She was the founder and long-term manager of the Caregiver Support Center in Montreal. In 2003 and 2012, she received the Queen's Jubilee Award, presented by the Canadian Home Care Association, for her dedication in developing a national coalition to support caregivers. She's been a key architect of screening and assessment tools of family caregivers and done training for professionals across North America. On a personal note, Lucy would like you to know that she was a caregiver for her mother for almost 10 years. And with that, thank you guys so much for being here this morning. We're so happy to have our experts with us. And I think everyone is looking forward to this presentation. Welcome.
Thank you so much, Evelyn. Good morning, everybody, and welcome. So glad that you're with us. Yes, sadness is something difficult for most of us to process and to cope with, and it's hard to talk about it. That's why we decided to do a session about sadness. As well, we're going to explore anticipatory grief. One caregiver in our last session really brought up the subject, so we're going to cover that a little bit. You know, sadness is normal human emotion that often occurs in response to upsetting, painful, or disappointing situation. This emotion can vary in intensity. Like other emotions, it is temporary and it can lessen with time. So feeling of sadness can be intense depending on their source, but this emotion is also often accompanied by lighter moments. Even when you are sad, you feel okay at times and comforted by those around you. You might feel better after crying or discussing your feelings with a friend. But we know that millions of people around the world experience sadness or depression at some point in their lives. However, recognizing the difference between a diagnosis of depression and the emotion of sadness can help a person process both in a helpful way. So that's really very important to keep in mind. Sadness is a normal human emotion. I said that every single person will experience at stressful or sober times in their lives. A number of life events can leave people feeling sad or unhappy. The loss of absence of a loved one, divorce, loss of a job or income, financial trouble, or issues at home can all affect mood in a negative way. For example, failing an exam, not getting a job, or experiencing other disappointing events can also trigger sadness, because that's what emotions are all about. We get triggered. However, a person experiencing sadness can usually find some relief from crying, venting, or talking out frustration. More often than not, sadness has linked to a specific trigger. Sadness usually passes with time. It does not pass, or if the person becomes unable to resume normal functions, this could be a sign of depression. So what I mean by normal functions, we'll go over it a little bit more. You don't feel like getting out of bed, you don't want to shower, you lose interest in things like that. If low moods gets worse or lasts longer than 2 weeks, the person should talk to their doctor. It's really important to be able to do that. So if it really continues the sadness, please see your doctor. So let's look at depression. So I want to just give you the difference between. So depression is a mental disorder that has an overpowering effect on many parts of a person's life. It can occur in people of any gender or age and alters behaviors and attitudes. I want to share some research with you. In 2021, 21 million US adults experienced a major depressive episode, which is about 8.3% of the overall US adult population, according to the National Institute on Mental Health. Elliot will speak more about what the research shows about depression in the US. However, depression is a common mental illness that can affect people of any age, race, or ethnicity. So these are just a few examples of depression, feelings of discouragement, you're completely feeling lost, sadness, hopelessness, a lack of motivation, you're totally not motivated, a loss of interest in activities that the individual once found extremely enjoyable.
Thank you so much for helping to explain the difference between sadness and depression. That's going to be key during our conversation today. I think that element of how long the feeling lasts is so important and how disruptive it is in your ability to function as a whole. A more recent study from 2024 from the National Council on Aging found that in the US, an estimated 20% of adults aged 65 and older experience some type of mental health concern, including depression. So it's interesting that the 2021 study looked at the overall US population of adults, and this study more specifically looked at seniors. And if you compare those rates, it's more than double among seniors. So it's really important that we're mindful of some of the impacts. For example, major depression. While most older adults are not clinically depressed, estimates for major depression in older adults range from anywhere between 1 to 5% in those living in the general community. And those with clinically significant symptoms account for about 13% of adults 65 and older. Now, some of the factors that lead to depression do include health conditions. For example, thyroid. Other health indicators can also link with depression. Many men who undergo heart surgery wind up experiencing depression afterward, as an example. But chronic diseases, social isolation, and also bereavement are key risk factors for depression in older adults. Um, I was speaking with a caregiver recently who had shared that among her friend group, how many people had recently passed away. And that can certainly lead to isolation and obviously feelings of prolonged sadness. There are also other mental health concerns that we're seeing more commonly, for example, anxiety. This is becoming very common among older adults. It happened during the pandemic. Many of us all experienced that, but anxiety is also part of dealing with uncertainty, which we spoke about in our last program. It can also precede or co occur with depression. And there's some interesting research coming out of nursing homes about the rates of major depression among residents at very high rates and higher than those in the general community. So it's also important that we're mindful about the mental health of our care recipients and certainly those in long-term care. I do see a question from Eva. Was COVID-19 factored in those depression percentages? So yes, the data was published in 2021, so it does reflect a period prior to that time. But certainly during COVID, we did see higher levels of depression. However, we have seen that continue. I think perhaps COVID triggered some mental health concerns in the population. A lot of people don't deal with those things. So when not dealt with, they can get worse over time. Now, we're reciting some of the research and data really to drive home the points that caregivers can experience both feelings of sadness and depression along the caregiving journey. They're different. And how we acknowledge those experiences and how we deal with them, I think, are key, just as I was saying. Sometimes if you don't deal with something, it can creep up in a different way later on in your life. And so, really, the program that we have today on sadness is important, not in terms of the data and research, but in terms of the fact that research has found that a person who does provide someone with care for dementia, for example, that person is twice as likely to suffer from depression as someone who provides care to someone without dementia. And in part, that is because of the stress of the deterioration of a loved one's mental and physical abilities for the caregiver. So, dealing with dementia related behavior is also a factor in contributing to depression because that can be very difficult. Dementia related symptoms, for example, like wandering, we know that that can certainly trigger anxiety among caregivers, but agitation, hoarding, embarrassing conduct, and resistance or non cooperation can make the everyday experience of providing care very challenging for a caregiver, and even more challenging to get respite, for example. So, the more severe the case of dementia, the more likely the caregiver is to experience depression, according to the research, but we also know this from our experience. And really, it's critical for caregivers, especially in these situations, to be mindful of your mental health, to also try to get support whenever you can, and respite if it is possible. Now, it isn't just dementia caregivers, though. There are differences, interestingly, in gender. And women who are caregivers tend to experience depression at a higher rate than men. Now, yes, of course, we know that women do provide the majority of caregiving. In the United States, about 12 million women experience clinical depression each year, which is about twice the rate reported by men. So if you think depression is all in your head, think again. A Mental Health America study found that many women do not seek treatment for depression because they're embarrassed or in denial about being depressed. In fact, about 41% of women surveyed cited embarrassment or shame as barriers to treatment. And yet, women, interestingly, in my opinion, are socialized to be more communicative than men in our society, certainly when it comes to feeling depressed or sad. So it's really interesting. Men who are caregivers deal with depression quite differently. They're less likely to admit to depression. That may be why we see a difference in the data. But doctors are also less likely to diagnose depression in men. And that can also be why women report and experience clinical depression more than men. So men will often self-treat their depressive symptoms of anger or irritability or feelings of powerlessness with sometimes overwork or even with alcohol. And although male caregivers tend to be more willing than female caregivers to hire outside help for assistance with home care duties, they tend to have fewer friends to confide in or positive activities to engage in outside of the home. Now, the mistaken assumption that depressive symptoms are a sign of weakness can also make it especially difficult for men to seek help. It's interesting, too, that we're now seeing among women caregivers higher rates of alcohol consumption. So it's a trend that we're seeing actually across our 65 plus population, but also among caregivers. Now, our health is how we feel. And that, to me, includes our mind, our body, and our spirit. So it's very important for our mental and physical health to get a complete physical exam. So take the time, if you can, to get an exam if with a doctor and bring up any feelings of depression if you're experiencing them. Because as I said, I think our well-being encompasses how we're feeling in our mind, our body, and our spirit. So before we continue, I just thought, since I know this is a very heavy subject and we have so many people participating today, if anyone has any comments or questions or anything that they wanted to share.
So this is your opportunity, folks. I have a little website here. So if you are on the phone, press *6 and I will know that you have unmuted your phone. I can call on you. And you can also put stuff on it in the chat box. And we will pick that up. You can raise your hand. And we would love to hear from you.
Does any of this resonate with any of you?
Yes, I
Yeah.
think we can add chronic pain to the list of things that make people depressed too.
110%.
Absolutely.
All right. Well, I don't see any comments or questions yet,
I've
but
got one, Michelle Fry. Would you like to speak to us?
I'd like to. Can you hear me?
yes,
Yes.
yes.
Okay, I have noticed as my husband who's in assisted living, his Alzheimer's has affected him even more. And a hard part for me is when I plan something out for him, like going to a athletic event. And I get there all prepared. I've got people prepared. I've called ahead to get disability location for parking. And then he's not capable of going. I always test him out, make him walk in the hall, and he was just not there. Fortunately, I had friends coming, so I did go myself. But it's just like that sadness for him and the sadness for me. It's like, it's too much at times. So I have to try and step back and balance it out. And, I went there after the game and he didn't even realize that I had gone and the game had occurred and he didn't go. So it's just those type of things when you plan a big event, even if, it can be holiday, adjusting to that and without letting it linger inside of me and build. So,
Right.
thank you.
Thank you, Michelle, for sharing that. What I'm hearing is that there's a lot of levels of sadness that you're experiencing. The sadness of the mental deterioration of your husband, the sadness of maybe not being able to enjoy activities together. And just the fact that you're able to identify that and talk about it is the beginning process of trying to have, to deal with it. And I talk about it, well, both Elliot and I talk about acceptance. It's very difficult. But if I can share my own experience, when I finally did accept my mom for her limitations and what I could and could not do with her, it kind of really helped me in my own caregiving journey.
And I think something that is very difficult to cope with is also the coming to peace with perhaps not being able to make those plans and taking it moment by moment and day by day. And I think that is one of the hardest parts for many caregivers is when that switch is turning that switch and recognizing that you have to just go with the flow rather than planning things out, which can be so difficult because you need, for example, all the things in place that you talked about in order to make those plans. Um, but that can then make it more stressful and more upsetting for you as well. So perhaps there can be other kinds of plans that you do with your husband at the facility, something that you can do together that you look forward to that's easy. And so it creates a different kind of experience, but one that you can still have that's very positive. So I try to always look for ways to sort of go with the flow.
And you have every right to be sad, and deal with it, as long as that sadness doesn't escalate and make you depressed. So keep track of that.
I have
We
something
do.
to say.
And also like, oh, there you
Please.
go, Phyllis.
Yes. Um, I'm just agreeing with everything that everyone is talking about, the sadness, because I have that often with my mother. She's has dementia, and it's just I'm not used to seeing her like that. So it makes me very sad and sometimes depressed about it. But I get to myself and say a prayer and do my crying or whatever I have to do, and then I'm okay. But it's very hard to see her go through this because I never expected this, but you never know what will happen So I'm a living witness to that because I never expected this with my mother, but I'm the caregiver here. My brother and sister, they really can't handle her. You know, everybody's not cut out to be a caregiver, and they are not. They do their part, but she depends solely on me. And if I leave and try to get out for a little bit, she come and peep in my room. That's what they tell me, and see if I'm back. And she just up and down until I get back. So um, it gets very depressing sometimes. That's all I had to say.
No, what you had to say is so meaningful because it people feel that they're not alone, that it's
Right.
common, that these are the feelings that we go through as being caregivers and being able to talk about them. So I thank you very much for your comment.
Yes, ma'am. You're welcome.
I echo that. And I also, in addition to the feeling of the sadness and the depression, I can imagine it feels like an immense pressure on you to also always be there, knowing that your mom appreciates your presence. So, if I may impart a little bit of wisdom, if you're feeling bad when you're with your mom, take a moment, go to the restroom. If you have a smartphone and there's a comedian that you enjoy or something that makes you smile, try to take a moment and enjoy that. Um, it can really be helpful in just, giving you a little bit of balance in those moments.
Okay, thank you for that.
We have another chat from Deborah.
Yeah.
I already had been diagnosed with depression and anxiety. It has just been amplified as caregiver for parents with cancer and dementia. How do you know if it is getting worse?
Go ahead.
I can start if you'd like. So my suggestion is to all the caregivers who may be participating today, not just Deborah, if you have previously been diagnosed with depression or anxiety, anytime you're going through a tough time, that can be a trigger. So during these tough times, which include being a caregiver, make sure that you're being followed by a psychiatrist or a therapist if you've already been diagnosed with a mental health condition, because it can help you to answer those questions along with a professional who knows your baseline perhaps and knows where you're optimally at. So to answer that question of how do you know if it's getting worse? Well, if it impedes your function, if you're feeling for more than 2 weeks at a time that you're feeling your mood is really low or down, if you're finding that your anxiety is prohibiting your ability to do things that you normally do, these are examples of things getting worse. But I really, really recommend to all those caregivers, it's a stressful, stressful journey. So if you've already been diagnosed with a mental health condition, make sure that you're checking in with someone, a professional.
That's the chats for now.
Yes.
I don't know if Lucy, if you had anything to add there,
No, I
but
think everything you said is right on, just in more practical, just little hints. Like, as I was saying, if you really can't even get yourself out of bed or you're just not motivated to do anything, these are your clues and your cues to say to yourself, I got to go see my doctor.
yeah, absolutely. Thank you, everyone, for your candor in sharing with us. So I want to continue on a little bit about depression, which may help to answer some of the questions we had. So, a thing that a lot of caregivers experience is interrupted sleep or a lack of sleep. And lack of sleep contributes to sadness and also to depression. Now, while sleep needs vary based upon each person, some of us need more than others, most people need on average 7 to 8 hours of sleep a day. The loss of sleep as a result of caring for someone can lead to really more significant feelings of depression as well. And the important thing to remember is even though you may not be able to get your loved one rest throughout the night, you can arrange, as much as you can to try to sleep on their schedule, if that is a possibility at all, or hiring a respite worker to engage with your care recipient, for example, so that you can take a nap. There are also options of finding a day center or scheduling a stayover with another family member, for example, for yourself or your care recipient, depending on what may be easier. But sometimes really putting your own need of getting sleep for a few nights can be so important. And you may need to make arrangements for that to happen. Now, depression can persist also after placement in a care facility. We heard that from a participant today. Making the decision to move a loved one to a care center is in and of itself very stressful. And while many caregivers feel like they're finally able to catch up on needed rest, the loneliness, guilt, and the monitoring of care of a care recipient in a facility at a new location can also add stress. Many caregivers feel depressed at the time of placement, and some continue to feel depressed for a period thereafter. That is common. People also assume that once caregiving is over, the stress from providing hands on care will go away. But we know that even from some research, 3 years after the death of a spouse with dementia, some former caregivers continued to experience loneliness and depression. And so we always say how important it is to try to balance your life as a caregiver because it gives you something to keep as a routine at any point along the journey. And in an effort to return to normal life, many caregivers may need to seek out some professional help as well.
Thank you for that, Elliot. You know, we do receive questions from caregivers. We wanted to share this one with you. And this is what the person wrote. I've been a caregiver for my mother for several years. She was diagnosed with Alzheimer's disease the year that I retired, which has been a blessing and a curse. It allowed me time to care for her in my home, but did not allow me to ever stop working or to consider what I may want for my retirement years. Recently, my mother's condition deteriorated to a point that I have to place her in an assisted living facility. Since placing her, I've been overwhelmed with sadness. I feel like I've been on a caregiver treadmill for years. And now that my mother's care has transitioned, I have time on my hands and I'm finally processing all of the feelings I have about her illness, my role as a caregiver, my sadness and watching her decline over these years, and my sadness for my retirement years lost, and now not knowing what my next move is. I keep crying and feeling very emotional, and I'm not sure how to proceed to process everything. So first of all, if you're with us, thank you for your honest email. And I'm really so sorry for all your losses because there's a lot of losses here. So in the reality, I don't know how long you've been feeling this sadness, but it is, if it persists or if you feel you can't shake the sadness that you're feeling, again, exactly what we've been saying, it may be helpful to speak with a doctor or a mental health professional so that the sadness does not develop into a depression. That's important. So that being said, you know, it would be normal to feel emotions now that you are able to process them and give yourself the time. That's also the beauty of retirement, is that you can give yourself that time and you don't need to be on everyone else's schedule. We all process things differently, and you also don't need to plan out the rest of your retirement years right now. Take one day at a time. That is so important. The fact that you are acknowledging your feelings is the first step to getting help for yourself. You deserve it. Dealing with your emotions will help you to plan for your future. And I want to wish you all the very best. So let's take a look at coping with sadness. You know, here are some ways to experience normal sadness in a healthy way and to allow this emotion to enrich your life. Allow yourself to be sad, first of all. Denying such feelings may force them underground, where they can do more damage with time. Cry if you feel like it. Notice if you feel relief after the tears stop. If you are feeling sad, plan a day to wallow. Plan a day or evening just to be alone, listening to melancholy music, and observe your thoughts and feelings, planning time to be unhappy can actually feel good and can help you ultimately move past the sadness into a happier mood. And I've always shared this with everyone. I gave myself one day of just feeling so sorry for myself. And I have to tell you, it does help. Gives you a time, because Elliot and I both say it's time limited, okay? Think or write about the context of the sad feelings. Are you sad because of a loss or unhappy event? It's usually not as simple as discovering the cause of the sadness, but understanding why you're sad and exploring those feelings can help you feel better. One of the things we talk about a lot is take a walk. Sometimes some fresh air and a little quiet time can change your perspective. You know, breathing exercises, these are so important for you to be able to manage some of your feelings. Call a close friend or a family member. Sometimes venting your feelings can help you process them. And most important, be kind to yourself. This may include a hot bubble bath, a nap, or splurging for some really good chocolate, if that's what makes you feel better. And you deserve it. Okay, so tell yourself, I deserve this. Let yourself laugh. That's one thing that Elliot constantly tells us is a great tip. Fire up a favorite comedy. Watch it and find the funny YouTube video. Consider starting a gratitude journal. That is very helpful. Focusing on the positive, even if you can only think of one thing to be grateful for daily, helps you shift away from negative and sad feelings. Remember that sadness can result from a change you didn't expect or a signal that there need for a change in your life, that something needs to change. Change is usually stressful, but it's necessary for growth. If you're sad because you need to change something, think about the steps you can change to make your life more joyful. Are there any questions or any comments? If not, we'll continue with Elliot.
Don't have anything. If you're on the phone, press *6 and unmute yourself, and I can see that you've done that. Right now.
All right. Well, I'll stop at any point if I see something in the chat. So I think this is such a good tie-in to a question that we received from Deborah earlier. When do you know if it's time to seek out help? And with regards to depression, my question always is, why would you want to suffer? And so I'm a big proponent of speaking with your doctor, having an honest conversation. Sometimes medication is not the right approach. It might just be situational. But you're best able to make those decisions when speaking with a healthcare professional. I also want to emphasize that if you're feeling crisis or sadness or depression or anxiety, and you need to talk with someone, you can always call 988. You can do that from any phone. You can also text with them, and it's free. So it is a great resource. I said again earlier that to me, our health encompasses our mental health and our physical health. So they're not, one is not more important than the other, in my opinion. They're equal. And so if they're intrinsically linked, if they're equal, it's so important to seek out help from a physical perspective, and going to a primary care physician if we need to make sure that everything's okay, but also perhaps speaking with a mental health professional. Now, of equal importance, it's not uncommon for a person receiving care who may have dementia or Alzheimer's, for example, to also be suffering from depression. I mentioned earlier that depression can be commonly seen in nursing homes. So it can be very difficult if a person is cogent to be in a position in which they need care. Aging at the best of times can be depressing if it comes with diminished health or quality of life. Evelyn spoke about chronic pain. That certainly links with sadness and depression. It's very hard to enjoy life when you're uncomfortable. So again, why I believe that physical and mental health are linked. If you have any concerns, seek out care from a provider. If you're concerned about your health, about your care recipient's mental health, rather, try to seek out care for them as well if they're able to communicate about how they're feeling. It's very important, and there are medications that can be very helpful. So, this is exactly how depression can be treated. Now, the first step, because many people are not quite sure how this all works, the first step to getting best treatment and care for depression, obviously, is to meet with a mental health professional. But that can include a psychologist, a social worker, and there are also other kinds of licensed mental health therapists depending on the state in which you live. At the same time, I really recommend scheduling an exam with your doctor. Now, a lot of people ask, but there is no blood test for depression. We have other markers and scales that doctors may use to ascertain a diagnosis of depression, but this is where I'm a big advocate for speaking candidly about what you may be experiencing. For example, if you go and you see a doctor and they give you a depression questionnaire and you're having a really bad week as a caregiver with your care recipient, things are just not good. Your responses on that questionnaire may be influenced by the severity or the impact of what you're going through. So, again, it's really important to share with a professional all of the range of your experiences so that you can know what approach for treatment may be best for you. Only you and your doctor, like a primary care physician or a psychiatrist, really will be able to make those decisions. And a physician or a psychiatrist may want to prescribe medication. And although they may prescribe, for example, an antidepressant medication, medication alone is not the most effective treatment for depression. Usually, it combines mental health counseling along with medication. And a therapist or counselor will have the time then to be able to listen to your concerns, perhaps more thoughtfully screen you for symptoms of depression over time, and assess you in different ways to help you adapt to what stresses you may be going through and help provide you with skills to build new and more helpful coping patterns. Now, one way to find a professional is to ask someone that you may know. You're in health insurance, obviously. Um, and employers, if you are working, also typically have what's known as an employee assistance program, which allows you access to free, brief, short term counseling through a mental health professional. And that can be done by phone, Zoom meetings, or in an office setting. So it's important as well if you do seek out treatment to discuss with a mental health counselor, for example, again, your caregiving situation. We know that one of the things that um, prevent many caregivers for wanting to commit to mental health counseling is that the nature of being a caregiver can be erratic and it can be very hard to schedule something that you're committed to on a weekly basis. Again, this is why sharing your situation is so important. And, perhaps then finding a counselor who may be able to see you through telehealth, that may be a good option. So we talked about, getting help with depression through a mental health counselor. If you do seek out treatment, find out what the costs will be. For example, if you are in mental health counseling, many people costs can be a very significant barrier. For example, even with insurance. And it's important to seek out counselors who have experience with caregivers wherever possible. In your community, if you reach out to your local AAA, and you can access them by calling 211, your AAA will often have some resources with therapists who do work with caregivers in your community. The same goes for gerontologists and geriatric psychiatrists, for example, which can be the hardest to find. All very, very important. Again, I don't believe in suffering. And if you feel like you may be experiencing signs of depression, I think it's a great thing if people ask, well, what should you do or how do you know? In my opinion, if you're asking the question, that's how you know. And I will say it again to all the caregivers out there. If you've ever experienced a mental health issue, The stress and the experience of being a caregiver can trigger that. So it's really important to keep in check with a doctor. Does anyone have any questions or comments before we go on?
Press *6 if you're on the phone, and I'll see that you were trying to talk to us.
I guess
Right.
what I just want to kind of mention that there is still a stigma in our society about anybody accessing help for depression or mental health. It's better than it was, it's true, but we still have to recognize that anyone who suffers from any form of mental disease is no different than if you have a heart condition. It's another part of the organ in your body. And you should never be ashamed. And as Elliot said, nobody should suffer.
Why suffer? I'm not a believer in suffering.
Me neither. Okay, so anticipatory grief is something that came up in this series a few weeks ago by one of our caregivers. So we wanted to talk more about this. So what is it? Which is hard to even say. Anticipatory grief also refers to an anticipatory loss. That means, something you're concerned about, a loss that might be in the future. This is the distress a person may feel in the days, months, or even years before the death of a loved one or other impending losses. This is very common among caregivers of people with later stage degenerative disease like Alzheimer's, Parkinson's, MS, or even terminal cancer. The younger the person is, the more severely they may experience this grief, particularly as it relates to death. In a review of 15 studies exploring anticipatory grief and illness, doctors at the University of Illinois at Chicago found that younger caregivers and younger patients tend to report higher ratings of anticipatory grief. One of the reasons for this is that anticipatory grief is forward-looking. Younger people tend to be forward-looking. So it's not surprising that younger caregivers reported more anticipatory grief, which is really the grief of, quotation, what we still believe we might lose. All right. This leaves space for hope, however unrealistic that the loss may not occur. So let's look at what you might feel when experiencing anticipatory grief. So people undergoing that report a range of feelings that they could include anger, irritation, anxiety, denial, the desire to withdraw for social situation. So sounds a lot like depression, right? And again, depression, dread, guilt, and intense preoccupation with the dying person. Like they're so involved with them. Not being motivated, loneliness, loss of control over one's emotions, sadness, and tearfulness. So again, if you're experiencing anticipatory grief, it's important to talk about it with someone. Grief is a universal human experience. Common counseling intervention, including narrative therapy, which can help the grieving person reframe loss, and active listening, which allows the grieving person ample time and space to talk out their feelings by a person who really asked the right question. So it's always important to find the right counselor. Now, again, if you're so overwhelmed and concerned about losing that individual, you're kind of in a grief process already. So don't wait. Go and get the help that you need, because it's important to kind of visualize all the things that might happen so that you feel some control in your life. So again, if anybody wants to ask a question about anticipatory grief or anything, it's the time that you can do that now.
I do. This is Phyllis.
Go ahead.
Okay, I have like 2 or 3 questions. Does dementia always lead to full-blown Alzheimer's? That's one question.
So the answer is depends on the diagnosis. There are many different types of dementia, and not all of them, for example, are linked with Alzheimer's. So it's important to know what specific type of dementia your care recipient might have.
Okay. Will dementia stay at a dementia stage, or will it always lead to Alzheimer's?
Great question. Again, depends on the type of dementia.
Okay.
So as an example, one form of dementia is Lewy body dementia. And that is different than Alzheimer's disease. And the symptoms that people experience can sometimes overlap, but there are sometimes differences. This is why a formal diagnosis by a neurologist, for example, can be so important in knowing what approaches might be best.
Okay, my mother had, I'm not sure what type of dementia it is, but she's still able to do some things, and she have some good days and she have some bad days. For as dressing, she can still dress herself, but I have to be in there with her to make sure she has the right thing on and, just supervise her. So I'm not quite sure what type of dementia it is, but I know one thing, it keeps her up at night a lot.
Mm.
And they prescribed her a medication, and I tried it on her, and it was too strong for her because it seemed like it threw her into full-blown Alzheimer's, the way she was loopy and picking at things and wobbly. So I didn't give her any more of that. So what I did, I talked to her doctor and I asked, was there anything else? This the primary care physician.
Mhm.
And he told me to get some melatonin.
Mhm.
So I got the melatonin, and I got the 20 milligrams of melatonin. So I'll give her one of those when she's having a hard time resting, and it seems to calm her down pretty good. So, but that's about the only thing. She gets up a lot at night, and she puts her clothes on and fully dressed and want to come and sit up here. It might be 2 or 3 o'clock in the morning, and no,
Mhm.
I don't get a lot of sleep. I have this monitor, so I don't have to keep running back there. I have a monitor where I can watch her, and when I need to go back there, I do. But a lot of times she'll get up and put her clothes on, and then I have to go back there and ask her, just tell her, take your clothes off, Mom. It's 3 o'clock in the morning. It's time to lay
Mhm.
down. But I
Mhm.
put her some music on, some gospel music that she like to listen to, and it calms her down. So that's what I'm going through on a daily basis.
So Phyllis, my suggestion is to reach back out to the doctor.
Uh-huh.
If you're finding that the melatonin is helpful, there may be a benefit to giving it to her on a more consistent basis so that
Uh-huh.
she has a more restful
Come on.
night and that you're able to as well. I think it's also important to speak with the doctor and asking what form of dementia your mom has and
Okay.
what disease progression might look like. So that way you know what to anticipate
Okay.
in this process. That way you're not going
Okay.
to be caught off guard and you can help to better prepare for things.
I think
Right.
that's very, very good advice, Elliot. It's very important for you to know what you could possibly expect. But what I'm hearing is that, you really are taking on a lot. And we always say that there's two people in this relationship. One does not outweigh the other. You have to be very careful that you take care of yourself.
Right.
It just sounds to me that the whole idea of not being able to sleep at night and all the other things you're going through, there has to be a balance for you. So please, please take care of yourself. And maybe at one point or another, you have to look at really what's happening and can you continue doing what you're doing and caring the way you're caring. So I want to wish you all the very best, but you keep in mind that you're important and you deserve to have a life as well.
Thank you so much.
Of course, and thank you for the care that you provide. We have some chats. Nancy said the looming potential for the degradation of our safety nets and connected support adds another layer of uncertainty. Are medical and related professions planning for the loss or lessening of Medicaid, Medicare, Social Security, etc.? I will say yes. I know this because I work in education and I work with community organizations that support seniors here in South Florida. Funding from many organizations has already been paused, and they're trying to scramble and find ways of moving forward for right now. It is a time of great uncertainty. It's something that Lucy and I discuss because we had a session on uncertainty, and we know that this is something that's certainly part of our landscape right now. I think, the best thing we can do is to hope and advocate that these things continue to be sustained. We all rely and depend upon them. And that's, the best that I can offer for right now, unfortunately. We did get another question. Tracy asked, are PCPs, so primary care physicians, generally equipped to manage dementia patients, or should a neurologist be involved in care? Such an excellent, excellent question, Tracy. Thank you for that. Ideally, a neurologist should always be involved. The problem is that there is a shortage of neurologists nationally, and even more so, a shortage of neurologists who deal with geriatrics specifically. So that can make it very, very hard to get access to one of those specialists. In many communities, PCPs are trained in geriatrics. They do have expertise in managing dementia patients, but in other cases, that's not true at all. So it can be very hard to find a PCP that is equipped to be able to manage dementia patients and care. That's why I recommend reaching out to your AAA in your community as an example to see if they have any resources to help orient you. Usually also in communities where you may have a medical school or teaching hospitals, geriatrics and dementia care tend to be part of that training curriculum now. So you may have better luck finding physicians who train our next generation of physicians out there and who may have the expertise to be able to provide. Any other last questions? Okay, very good. I am seeing that we are short on time, so I'm going to wrap up really quickly. I just want to reinforce that, sadness is a very difficult emotion for people to talk about. I really want to thank our participants for their candor and for their sharing. That's why we're here. Groups like ours today are very important. And again, there are grief and crisis groups in your local community. You can call 211 to find out more resources. Also through NAMI, the National Alliance for Mental Illness. I hate the name, but they do great work. And they have amazing resources, including a crisis health line. There are a lot of studies actually looking at telehealth interventions now for caregivers. And this came out of the pandemic because we used telehealth a lot. What was found was that caregivers who received counseling support, for example, through telehealth, had significant improvement in their caregiver outcomes. So that means not only did the person getting the counseling benefit, but the care recipients benefited too. So I really, really implore those people participating today, and I'll say it again, if mental health is a concern, seek out help. It will help you and your care recipient. And having perspective is so important, as I mentioned. When you're exhausted, it can be very hard to feel positive and optimistic. So take stock of where you're at. And for our caregivers who are also isolated, we know that that can also make things harder, and your perspective can become askew. Isolation is linked with depression and feelings of sadness, so get help if you need it. We have lots of resources as always to share, which I will leave up as Evelyn shares some last information with you all.
Thank you, Elliot. Thank you, Lucy. You guys do such a beautiful job. And I really appreciate the participants today who enriched our program, both with your questions and with your experiences. And I hope that you got some really good little nuggets out of the presentation today. I know I did. I wanted to tell folks that generally Lucy and Elliot send out their slides so that you have the resources, but there's always the podcast that you can look at too. And you can either look on YouTube at WellMed Charitable Foundation, or you can go to caregiverteleconnection.org. Now, the resources that we talked about, or the slides and anything else that we're going to put up here, you won't get unless you're registered. So it's really important that if someone gave you the number or the link to the Zoom, that you go ahead and call this WellMed Charitable Foundation customer service person at 866-390-6491. It's that first phone number up there, because you'll not only get the resources, you'll get the monthly calendar. And while I'm talking about the monthly calendar, I just want to let you know that it has just come out. And we have some of our, best and greatest. Dr. Tam is going to answer your questions about Alzheimer's disease, and she's a wonderful expert. There's one entitled, "You Have the Power to Reduce Your Risk for Falling." There's another one that will be in Spanish, and it's a guide on how to live with Alzheimer's disease with one of our few geriatric psychiatrists in the country. And I think there's only 4,000, and most of them are older because young people don't want to go into geriatrics, in my opinion, my take on things. There's one, "When Enough is Enough, Setting Boundaries." Such an important Dear Lucy topic. And she's going to help us with that, because it's hard to say no to people, or hard to say, "Will you help me out?" Because we're not good at asking for help. We're also going to talk about hoarding disorders, and this is on March 18th. Let's not call them hoarders. Hoarding disorder, let's not call them hoarders. And then on the March 27th, we're going to have mindfulness and relaxation at your fingertips. And that should be a good one. I look forward to that one too, as I do all of these. And I want to thank you folks so much for your participation today. Lucy, Elliot, for your beautiful job, as always, your research, giving us the state-of-the-art facts on what's going on. And with that, I am going to say goodbye to everybody, and I'm going to stop the recording. And I want to thank you all so much for being with us today, and hope that we see you again very soon.
Thank you, everybody.
Thank you.
Take care of yourself.
Bye, everyone.
Bye, everybody.